Greetings from Jalaluddin of Oncology. We are observing the September 20th as World Gynecological Cancer Day. And on behalf of that, I'd like to pass a message on endometrial cancer, which is one of the commonest gynecological cancer among women. And there's an increase in the number of these cancers lately due to increased number of diabetics and obesity. But it is a cancer that we can diagnose early because of a symptom, that is postmenopausal bleeding, should alert the patient of some danger existing. So one of the important things what we should think is prevention, and then if possible early detection and then treatment. Prevention is control your diabetes and control your weight. These are two simple steps. Early diagnosis is if there is postmenopausal bleeding, immediately consult a gynecologist or a doctor, and or if ever postmenopausal women have a regular checkup. The third thing is once diagnosed, most often we diagnose endometrial cancer in early stages, and it is easy to treat, and the treatment is surgery. Before we used to do radical surgeries, but now we do these surgeries with minimal, either with laparoscope or with robots. And before we used to remove a large extent of lymph nodes. Now we don't try to remove the lymph nodes, we remove only the involved nodes. The cornerstone and the important is treatment by surgery. Surgery is removal of the uterus, ovaries and the fallopian tubes and the lymph nodes. Nowadays this surgery can be done by laparoscope or by robot, whereby we need not do a large opening. As well as previously we used to remove most of the lymph nodes in the pelvis. Nowadays we try not to remove the lymph nodes. It's important that we diagnose the case early. So my parting message is that early diagnosis is very important, which can be done when the patient is aware that postmenopausal abnormal bleeding should be immediately reported, and also if possible postmenopausal women should be on regular checkup. So one has to be aware it is possible a young patient also can get this disease, but most often it is postmenopausal. So the important thing is an abnormal bleeding should be investigated, and an early detection will result in cure. And all these facilities are available in Jalaluddin of Oncology and can be diagnosed early and treated in early stages where we can actually avoid chemotherapy and radiation.